Hi everyone, this is Dr. Viet Lee from the Academy of Online Radiology Education. I work at Cincinnati Children's Hospital Medical Center in Ohio. I would like to thank our senior editors for their contributions to this month's Pediatric Radiology blog, Dr. Paul Gillerman from Texas Children's Hospital in Houston, Texas, and Dr. Alex Tobin from Cincinnati Children's. We are very excited to share the current literature in pediatric radiology with you.
Assessment of distal ureteral and ureterovesical junction, visualization on contrast-enhanced voiding urosonography. This was a retrospective study which determined that contrast-enhanced voiding urosonography can visualize vesicoureteral reflux. However, it is limited in the evaluation of the distal ureter and ureterovesicular junction anatomy. Therefore, fluoroscopic VCUG should remain primary examination if surgical management is required. Contrast-enhanced ultrasonography in the evaluation of Crohn's disease activity in children. Comparison with histopathology. This was a retrospective study which determined that contrast-enhanced ultrasound was able to identify a majority of moderate to severe sites of active Crohn's disease in children. However, it was not able to identify all segments, and therefore, this could be used as a complementary method of disease monitoring as opposed to a primary form of assessment.
Diagnostic sensitivity and specificity of CT angiography for renal artery stenosis in children. This is a retrospective study from January 2012 to May 2019 that evaluated the sensitivity and specificity of CT angiography for assessment of hypertension related to renal artery stenosis compared to the reference standard of digital subtraction angiography, or DSA. The sensitivity for CTA for renal artery stenosis diagnosis was 90%, and the specificity was 89.7%. The accuracy was 89.8%. A major strength of this study was using the DSA correlation as the reference standard. Some limitations included retrospective review of the medical records and radiology reports, lag time between the CTA and the DSA, and technical variability between different CT scanners. The diagnostic value of magnetic resonance imaging in differentiating benign and malignant pediatric ovarian tumors. This retrospective study from October 2014 to March 2019 compared MRI characteristics of ovarian masses to the pathology results to evaluate the diagnostic value of MRI in differentiating between benign and malignant ovarian tumors in children. The authors conclude that MRI assessment of ovarian tumors can differentiate between benign and malignant tumors, particularly if the tumors are 8 centimeters or larger in size and have enhancing solid components along with ascites, peritoneal deposits, or extracapsular growth. They did not find statistical significance or correlation between ADC values and malignancy. All patients in the study were referred to a pediatric oncologic center because they already had a diagnosis suspicious for malignancy, which results in inclusion bias.
Immediate chest radiograph interpretation by radiographers improves patient safety related to nasogastric feeding tube placement in children. This was a retrospective audit where trained radiographers screened preliminary chest radiographs and gave reads of nasogastric tube placement. This was relatively successful, but requires proper training and adherence to a strict workflow. Confirmatory radiographs have limited utility following ultrasound-guided tunneled femoral central venous catheter placements by interventional radiology. This is a retrospective study which demonstrated high concordance between interprocedural ultrasound and radiographs in confirming femoral catheter placement. Therefore, if the catheter tip can be seen at the time of placement by interventional radiology, a chest radiograph may not be needed to determine proper placement.
Contemporary management of pediatric blunt splenic trauma. a National Trauma Data Bank analysis. This is a retrospective study that searched the National Trauma Data Bank from 2007 to 2015 using diagnostic codes for any grade of splenic trauma. Management trends, including rates of techniques, clinical outcomes, and failure rates during the study period, were described. Management covariates, including non-operative management, splenectomy, splenic repair, IR angiography with embolization, or combination therapy, were also described, along with demographic, clinical, and outcomes covariates, such as length of stay days, ICU days, and ventilator days. The study showed that non-operative management for splenic injury is associated with favorable outcomes compared to surgical intervention. There is also an increasing trend of splenic artery embolization for splenic injuries that do require intervention.
Fetal brain MRI findings predict neurodevelopment in children with tuberous sclerosis complex. This was a retrospective study which determined that fetal MRI can be used to determine the neurologic burden of tubers in patients with tuberous sclerosis complex. It demonstrated a higher lesion burden correlates with delayed cognitive and motor development in children as well as the development of autism.
Uncomplicated intraventricular hemorrhage is not associated with lower estimated cerebral volume at term age. This is a prospective cohort study of preterm infants born between 2014 and 2017. The outcomes analyzed were estimated cranial volume, estimated cerebral volume, Levine ventricular index, and thalamo-occipital distance. Additional clinical factors were also described. Using a 3D model and adjusting for gestational age, there was no significant difference at term equivalent age for cranial and cerebral volumes. The Levine ventricular index was significantly higher for patients with intraventricular hemorrhage. No difference was seen for the thalamo-occipital distance. Uncomplicated intraventricular hemorrhage in preterm infants was associated with multiple negative clinical factors and complications, including lower APGAR scores, higher crib scores, higher need for invasive ventilation and PDA treatment, and the presence of sepsis. Utility of skull radiographs in infants undergoing 3D head CT during evaluation for physical abuse. This is a retrospective study from 2017 to 2018. The most common location for fracture on both 3D CT and skull radiograph was the parietal calvarium. The most common fracture type identified on both modalities was a simple linear fracture. The authors determined that skull radiograph does not have added benefit in identifying skull fractures in infants already undergoing 3D CT for physical abuse evaluation, because there was no difference between the modalities for detecting skull fractures. The interobserver reliability was nearly perfect for 3D CT analysis over skull radiograph, which was only substantial in agreement. Thank you so much for listening. For more details, please visit our blog where you can also find the links to the original publications. Feel free to share your thoughts and questions on the Pediatric Radiology Forum. See you next time.